Music Therapy by Diana Concannon and Elizabeth Kane. What is music therapy? The National Cancer Institute defines music therapy as a form of complementary medicine that utilizes music to enhance overall health and well-being. It can involve activities such as creating, singing, moving, listening, or relaxing to music. This therapy is often used to help reduce stress, pain, anxiety, and depression associated with illnesses like cancer and their treatments. The American Music Therapy Association defines music therapy as a recognized healthcare profession that uses music within a therapeutic relationship to address the physical, emotional, cognitive, and social needs of individuals. A trained music therapist evaluates each patient's strengths and challenges to design personalized treatments. This therapeutic engagement helps patients develop skills and abilities that can be applied to other areas of their lives. Music therapy offers a unique approach for communication, especially for individuals who struggle to articulate their emotions through words. Extensive research has demonstrated its effectiveness in numerous areas, including enhancing physical rehabilitation and movement, boosting motivation for treatment engagement, offering emotional support to patients and their families, and providing a safe outlet for expressing feelings. The science behind music therapy. Music therapy operates as a multifaceted intervention that touches the physiological, psychological, and spiritual aspects of individuals. Its impact starts with how music, as a complex auditory stimulus, interacts with our brain's auditory cortex, influencing perception, recognition, and emotional processing. Individual responses vary based on personal preferences, cultural influences, and environment, but universally, music engages both sides of the brain through elements like melody and rhythm. Pleasurable music triggers dopamine release, tying directly to the brain's reward system. Physiologically, music interacts with body rhythms like heart rate and respiration, particularly through slower tempos, which promote relaxation and reduce cortisol levels. It's fascinating how music can entrain body rhythms, offering measurable biomarkers of relaxation, such as increased oxytocin levels and enhanced heart rate variability. Therapeutically, music functions as more than just a distraction. It provides emotional support, combats loneliness, and even fosters empathy when lyrics or melodies resonate with personal experiences. Music therapy truly serves as a powerful tool for comfort and healing in healthcare. The audience for this presentation is nursing education. It has been found that there are key challenges in the integration of complementary and alternative medicine. Research shows that physicians and nurses are open to CAM but lack confidence and qualifications to discuss it with patients or make referrals. Limited knowledge of CAM and its perceptions as a public health threat highlight the need for accessible, evidence-based resources. When using music as a therapeutic tool, research shows that in a study of oncology nurses, 55.5% were somewhat or very knowledgeable about using or referring to music therapy. There is also a high interest in learning to incorporate music into practice, but a low knowledge. This indicates a need for further education and training on implementing music therapy into practice. Opportunities for nursing education are incorporating music therapy and CAM education into nursing curriculum and professional training programs. Focused on evidence-based CAM modules to enhance understanding and improve patient communication. Overall, enhancing education for nurses will help implement music therapy and CAM into practice. Why is music therapy important? Music therapy promotes physical and mental well-being by enhancing brain function, including areas responsible for emotion, memory, and movement. It also supports emotional expression, especially for those who struggle to communicate verbally. Music therapy improves health outcomes by managing symptoms of chronic diseases, reducing stress, and enhancing quality of life. It also helps in rehabilitation by stimulating physical, cognitive, and social recovery. Music therapy is applicable across all ages and ethnicities. It's beneficial for children, adults, and seniors with different backgrounds and a wide range of conditions. It also has evidence-based benefits. Music therapy has proven to be beneficial in different disease processes and encourages social connection, releases feel-good hormones, and improves overall well-being. Music's influence in healthcare. In anxiety and depression, music can significantly reduce anxiety and depression, especially before surgeries in cancer patients and during dialysis treatments. In COPD, music therapy promotes relaxation and improves shortness of breath, anxiety, and sleep quality. In pain, music therapy reduces the pain intensity and emotional distress from pain in various conditions like childbirth, cancer, chemotherapy, and certain medical procedures. In cognitive impairment or dementia, music therapy reduces behavioral challenges and enhances emotional well-being and quality of life. In MS and Parkinson's, music therapy's rhythmic auditory stimulation and music-based movement therapy improve gait, balance, and mental health. In stress, music therapy reduces physical and psychological stress markers such as heart rate and anxiety. In stroke patients, music therapy helps assist with physical recovery, mood improvement, and cognitive function after a stroke. And finally, with safety, music therapy is generally safe. You want to avoid loud music, emotional distress, or those with movement injuries. Next is our patient case. Meet Max. Max is a 10-year-old boy who has a diagnosis of leukemia. He has been undergoing chemotherapy and radiation for months and has had several stem cell transplants. He has faced many challenges, both physically and emotionally, throughout his treatment. Emotionally, he experiences fear, sadness, and confusion towards his disease, while physically experiencing fatigue, pain, and nausea. Children with leukemia often face a mix of emotional and physical challenges. Emotionally, they may experience fear, sadness, loneliness, and confusion, particularly about their diagnosis and treatment. Cancer and its treatments can lead to significant social and emotional challenges for children. These challenges include low self-esteem, depression, anxiety, and academic difficulties, especially due to physical side effects like hair loss, weight changes, and absences from school. Children with cancer may also face long-term emotional issues such as PTSD, behavior problems, and difficulties with peer relationships. The high rate of school absences, often due to hospitalizations and treatments, exacerbates these challenges, contributing to academic struggles and social maladjustment. These experiences can negatively impact a child's mental health, self-concept, and future outlook. A recent study by the Journal of the American Medical Association reveals that childhood cancer survivors are at an increased risk for mental health issues such as depression, anxiety, and psychotic disorder. The emotional toll of pediatric cancer is exacerbated by the intensity of treatment regimens, potential relocation for care, and the physical and emotional side effects of treatment such as hair loss and fear of relapse. Treatment also affects brain development, potentially leading to long-term cognitive challenges in areas like attention, memory, and language. Creative outlets like art and music therapy, along with compassionate care, can help them cope and maintain hope throughout their treatment journey. The impact of music therapy on Max's healing journey. Music therapy has a positive impact on children with cancer. It alleviates anxiety, enhances comfort, and improves self-esteem, especially in relation to body image changes from cancer treatments. Additionally, it promotes better social interactions and communication with family and healthcare providers. Research shows that music therapy effectively improves the quality of life in children and adolescents with cancer. It can be used as a standalone treatment or alongside other therapies. Certified music therapists using evidence-based techniques offer significant benefits, while passive interventions by non-music therapists also produce positive results. This research is relevant to Max's case as it highlights the benefits of music therapy in reducing pain, anxiety, and stress, all of which Max experiences during his leukemia treatment. Music therapy can help manage pain and fatigue, distract from invasive procedures, and alleviate emotional distress like fear and confusion. It also improves self-esteem and promotes social interactions, which could support Max in dealing with body image changes and isolation. Lastly, music therapy can help relax Max by lowering heart rate and blood pressure, providing a non-pharmacologic complement to his medical treatment.
Music has been considered a healing therapy since the beginning of time. Shamans, ancient Egyptians, the Chinese, in India, and Greece understood the healing nature of music and linked practices of medicine to music. One of our own, no, not Taylor, but Florence Nightingale recognized the healing power of music. Nurse theorists since the 1850s have been using music theory as a tool to improve the overall health and well-being of our patients' physical and mental health. The nursing theorist that Diana and I will be touching upon is Catherine Kolkaba, a nursing theorist who used her theory of comfort to support the use of music therapy to reduce pain and anxiety for her patients. Her theory prioritizes comfort in healthcare and describes it as an existing in the three forms: relief, ease, and transcendence. In 1994, Catherine Kolkaba, an American middle-range nurse theorist, developed the TC, the comfort theory, based upon the care that was observed or given. She worked in the operating room, long-term, home care, and medical surgical specialties. Again, the theory of comfort is based off of three concepts: relief, ease, transcendence, and in four domains: physical, spiritual, socio-cultural, and environmental. Relief is the experience of having comfort needs met. Ease is the experience of care that promotes calm and or contentment. And transcendence is the experience in which care enables a person to rise above their problems. Kolkaba's comfort theory showcases that nurses can always provide emotional support to facilitate sociocultural release. They can play instruments such as the cello, the guitar, the sax, or turn on a music for comfort. I know personally that a woman that was terrified of being catheterized, I turned on some Fleetwood Mac. Now, we all know Stevie Nicks can solve most of the world's problems, but again, it put my patient at ease. And she had that rest, that feeling of hope and not being scared anymore. We all understand that music evokes feelings, that one song that makes us happy or sad, thinking about a past love or a family member. Right now I'm blasting holiday hits during a stressful time at the hospital. There's research-backed science behind the effect of music and music therapy, what it has on us. Studies have demonstrated that music impacts numerous parts of the brains, including those involved in emotion, cognition, sensory, and movement. My partner, Diana, and I worked hard on associating music therapy as a complementary therapy that can really help nurses and us as future providers. Please see below our references. Thank you so much for tagging along with us, and we hope you learned something.